Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Ghufran Babar, and you're watching my YouTube channel. Today's topic is regarding pregnancy and COVID-19 infection. As we know that the people who acquire COVID-19 could be males and females, and among the females could be those who are pregnant and expecting a baby. So what really happens? What is the risk of COVID-19 infection in these pregnant women? So there was a report released by CDC, the Center of Disease Control in America, on November the 2nd, describing the risks of COVID-19 infection on a pregnant woman's health. They did not indicate the effect on the fetus. It was just mainly for the effects on the health of women who are expecting a baby. So the symptoms are usually the same, like cough, headache, muscle pain, fever, shortness of breath, sore throat, chest pain, fatigue, sometimes difficulty in breathing, wheezing, loss of sense of smell or taste. But what they have noticed in this data that the pregnant women reported less symptoms, but they were likely to develop more complications. And there was a pregnancy data on almost 410,000 symptomatic women between January 22nd, 2020 to October 3rd, 2020. The data indicated that in these women who were almost 500,000, 23,000 were pregnant, and so they accounted for 5.7% of the total women who got or acquired this infection for this specific hospital, and 386,000 were not pregnant. So this data was adjusted for age, sex, ethnicity, and underlying medical conditions. So they broke it down how severe was the infection, and the severity is determined by the ICU admissions. So they noticed that 10.5 pregnant women out of every 1,000 needed an ICU admission versus 3.9 for non-pregnant women. As far as the ventilation, that is the ventilator requirement, 2.9 versus 1.1 per 1,000. So the pregnant women required more ventilator treatment, almost twice to non-pregnant women. The next thing was extracorporeal membrane oxygenation, in which there's a heart-lung machine and the lungs almost totally lose their function, and an outside machine cleans the blood and provides oxygen to it. So that's extracorporeal membrane oxygenation. So for the pregnant women, it was 0.7 every 1,000 women who got this COVID-19 infection versus 0.3. So it was almost double than the non-pregnant women. As far as the deaths that were reported, there were 34 deaths that were reported in these 23,000 women, which was 1.5 approximately per 1,000. While there were 477 deaths reported in non-pregnant women, which was about 1.2 per 1,000. So again, the deaths were a little higher in pregnant women versus the non-pregnant women. And the deaths were higher in those pregnant women who were between 35 to 44. So remember, the data starts from 15 to 44. So 15, the teenage pregnancy, but the risk for death was in older women who were 35 to 44 compared to 15 to 24. And then they broke it down to racial, racial profile in terms of African American. 14.1% of these women, the pregnant women, were African American. And out of all those deaths that were reported, almost 1/3 were in this group. and almost 40% of overall deaths were reported in this group. And there was also increased ICU admission for the African American women, whether this is because of delay in seeking the help or was it that when they had mild respiratory distress, they were not admitted. So was it just because of the ethnic or racial disparity, or was it delay in seeking care? Same is with the Hispanics, Pacific Islanders. Asians also had increased risk of dying with COVID-19 infection. So this data clearly indicate that the pregnant women are at higher risk of getting admitted to the ICU, being on the ventilator, and requiring artificial oxygenation compared to the non-pregnant women. So that tells us or summarizes that we have to be careful when it comes to pregnancy. So there's less exposure. So they have to wear the masks, stay at home as much as possible, social distancing, hand washing, and mask wearing. And making sure that in this season they get their annual influenza vaccine, get proper prenatal care, because during the prenatal care they could be monitored by their OB for any worsening symptoms. If they are COVID-19 positive, they should seek care sooner. Vitamin D is very important. They should have vitamin D levels checked, and depending upon what their level is, it should be replaced. If they are normal, then at least 1,000 international units per day would be appropriate for their treatment. So very important that the increased risk of COVID-19 on these pregnant women has to be taken seriously, and they have to take care of their health. And if their health is good, their coming baby and future baby's health would also be good. So hopefully you have learned something from this video. Please subscribe to my channel and share this video with your friends and family. May Allah bless us all. Best of luck, you guys. Sallallahu alayhi wa alihi wa sahbihi wa sallam. Thank you.